Hi, my name is Dr. Frank Pasciuti. I'm a clinical psychologist, and this is my channel called Dr. Frank's Therapoems. Now, I'm the kind of doctor that's a clinical psychologist, and I've been a psychotherapist, clinical psychologist, for about 50 years. And recently retired, thought to myself, there might be things that I can share with people that could be found helpful that I learned over that period of time as a therapist. And one of the things I decided to do was to try to distill some major concepts down into some simple, rhyming, rhythmic poems that I call therapoems. And the reason I call them therapoems is because they're mostly related to topics that come up in therapy. And they're the kinds of metaphors and analogies that people remember later on. Oftentimes, long after their therapy is over, they may hold on to one of those metaphors, and it just gives them a reminder of what they have worked so hard on trying to accomplish. Today's episode is Say What? Communicating Effectively. And communicating on the heels of the last episode we had is so important in relationships. But it's not just about you talking, it's about how you listen. When you're talking, you want, of course, deliver in a manner where you're clear, concise, and show respect for the person you're talking to. And also, if it's something that you're saying that maybe is a little bit sensitive to hear on the receiving end, it's always important to use some tact. And that's something that I had to learn in my own training as a therapist years ago, because I think I mentioned this in an earlier episode, the two cornerstones of being a therapist is being tactful and providing understanding. But I had an experience when I was training where I had a supervisee. I was not only training to be a therapist, but I was also training how to supervise therapists. And I was getting supervision about doing supervision. Seems a little redundant, but there was a lot of lessons to learn in all areas. And as my supervisor was listening to the tape of my supervision, he said, your comment was right on the money with telling your supervisee what he needed to be doing at that point. He said, but you got to watch out how you say it. Came off a little bit harsh. And I wasn't aware of that. I felt bad because I really liked my supervisee, and he did not say ooh or ouch. I know sometimes one of my own children, if I said something a little harsh, will always go zzz, So I have learned to try to be tactful and be aware of how my words come across. And I think all of us can stand to learn a lesson by that. But I have a poem I'd like to share with you, and it's called Being Frank. When we need to be direct and broach what must be said, if spoken diplomatically, we may not be misread. Because when said with tactfulness, it's easier to hear. Emotions can be managed well, and meaning can be clear. But even if directed well, what's shared may be ignored. Like water off a duck's back, it can be passed unabsorbed. When someone lacks the readiness to take in what we've said, while our ideas have worthiness, few penetrate their head. However, when appropriate, we still may want to cede the thoughts we feel must be expressed, despite where they may lead. You never know which land on rock and which hit fertile soil, but someday you may come to find that growth came from your toil. So say what you feel must be said, be clear while being kind, and optimize the outcomes of results you hope to find. So, giving feedback is important in life. And there's a couple of components about giving people feedback. One is, of course, non-judgmentalness. People don't want to be judged. They're going to be open to your input, especially if they're working under your supervision, or your children, or somebody in your life that you feel could benefit by hearing what you have to say. And always start with the positive. It's easier to get feedback if you can frame it in that way. And maybe it's not like you're trying to make something up, but see if you can identify something they did well first, and then move on to some constructive feedback. Be specific. It's important for people. Some people can hear things in a more general way, But a lot of people want to know exactly what are you talking about. And you could, sometimes you have to make an effort to do that. And don't make it personal. This isn't indicting the individual. It's basically sharing information about their behavior or how they're doing something, whether it's professional or personal. And the other thing is timeliness. It's better in close proximity to what it is you're addressing that you give the feedback. Because if you talk about something that happened yesterday, they may be lost in what exactly you're talking about. And even if they are aware of what you're talking about, it seems like it's kind of missed the window of opportunity to really have it take in the way you might want it to be. Now, the other side of communicating is listening, as I mentioned. And there's a process you may have heard of called being an active listener. Now, the interesting thing about being an active listener is you're working actively at just listening. You're not like reloading for what you want to say. You're actually trying to say, I'm tracking you, and I want to be assured that I'm hearing what you're saying. And there's a couple of steps in this process. One is, of course, ask questions. Ask pertinent questions to find out more information. Reflect back to the individual what they're saying. So that sends a message out to them. If they were saying, I have a problem with X, and they give you 5 reasons, you might reflect back. So you have a problem because of 1, 2, 3, 4, 5. That conveys to them, you're really tracking me. The other thing would be to paraphrase on occasion what they're saying. And again, you're still just listening. You're basically paraphrasing what I've heard you say up to now. Again, and you're moving together. It's always good to empathize because there might be more than just words being conveyed. If it's a relationship and the person is trying to communicate something to you, you may be aware that you're picking up on the undercurrents of emotion. And if you can provide empathy and say, well, it sounds like you're really angry about that, or geez, that really sounds sad as you're telling me. They may not be aware on some level that they are conveying that to you. And it might also affirm to them that you're really taking in what they're saying. You're not commenting, you're not judging. And the last thing you might do is summarize everything that they've said to you, including what you picked up on with feelings, a lot of the details. And what's interesting here is you've said nothing yet about yourself or about your position. And years ago, when I was teaching courses at both the University of Virginia and Michigan State University to teachers who were trying to get certified out in the field, I was teaching them this technique. And what I would do is I would pair people off. I'd find a topic like, are you pro-choice, or are you, pro-abortion, or anti-abortion, or, some juicy topic that I know there's going to be people who are going to be very opposite sides of that. And that's the true test, is can you listen to somebody, actively listen to somebody who's saying something to you that you don't agree with, without butting in and interrupting. It really takes work. And you'll be surprised because actually it can even help you. And I'll give you another example. When I was early in my career, before I even became a therapist, I worked in business as a salesman. I was trained to follow somebody who was quite effective as a salesman. And we went to this disgruntled person who bought the product we were selling. And this fellow just had a way with people. And it was interesting to witness because these people came in, when he came in, we came in, they were just giving him an earful. And he did a wonderful job of active listening. He didn't defend himself. He didn't defend the product. He heard their complaints. He acknowledged that these things happen, or that they can be fixed, or this is an exceptional situation. And in the whole tenor of the interaction calmed down, so much so that he was able to convince them to get another machine. He actually upgraded them, which was interesting because it was a machine they were using for their office, and it wasn't able to handle the amount of work they were putting on it. But it was a wonderful interaction to witness on my part as a young man, because I could see, oh boy, tough walking into a den of lions and trying to get everybody to be calm. So managing emotions can be hard, and listening to emotions that are coming at you or even being expressed about other people. And if it's about you, or if it's about a situation you're being asked to be involved in, then it's important for you, if you're the one who has strong feelings about it, to consider how you're coming across and how you're acting in that moment. And I have another poem here for you that I'd like to share with you. And this one is going to explain the image that is on the screen. It's called Be a Thinker, Not a Stinker. Be a thinker, not a stinker. At those times when you might think your high emotional reactions create toxic interactions. If your beliefs make you react, they need more thought before you act. You just may find that they're the cause. When reconsidered, you might pause. Don't let wrong thinking be the tail that wags the dog and makes you feel all out of sorts and so upset that you say things that you regret. Easy to do. When you're feeling really strongly about something, you may already be, as we say, loaded for bear. And it's hard for other people. It takes a certain amount of effort to try not to over-emote in a given situation if you want to handle things. And it's totally fine if you feel frustrated. You could say, I feel frustrated. But there's always a requirement, I think, for all of us to work at this. Now, you don't have to be perfect, but it's called emotional containment. And sometimes, you can maybe just learn how to just, without having to express it. And it's interesting because sometimes you don't mean to, but something will come out of you that you're really feeling and you're not concealing. And we call these Freudian slips. And I think we probably are all familiar with Freudian slips. And I have a poem for that one too. I want to share it with you. It's called Your Freudian Slip is Showing. Your Freudian slip is showing. You spoke what you really were knowing. You mistakenly said what was inside your head. Let your primary process go flowing. Are there times you regret what you share and say mean things when loaded for bear? Just because it's your truth, say it harsh and uncouth, make it hurtful for people to hear? Then know when to zip up your lip. Hold your tongue and avoid such a slip. Because once something spoke, it can't be recloaked. It's not wise to just shoot from the hip. So it's sometimes you're gonna reveal something and it'll come out, and there's a couple of funny things. There was one of Ted Kennedy many years ago. He was giving a talk to people and he was trying to tell speaking before a women's group. He's trying to tell them to do their best, and he said, do your breast. And I think everybody cracked up hearing that one. And there's another example of somebody who calls their present spouse by their ex-spouse's name or something, and that is like, oh gosh, where did that come from? But we learn how to just be tolerant of ourselves. We're all not perfect. So then we move on to the nonverbals that get communicated. And this is interesting because there's a quip I like. It's called, don't look at me in that tone of voice. Because sometimes how you talk and how you're positioning your body, if your arms are folded or your legs are crossed, or you're leaning forward, looking aggressive, or you're just kind of like looking at your phone. There's a lot of ways in which people get a sense you're not interested in what I have to say. And another story for me is I recall wearing a watch for the first time when I was in that world back in my early 20s of business. And it was a nervous thing. I would look at my watch, and I was in the middle of an interview and somebody said, do you have someplace you need to go? And I thought, oh my gosh, I wasn't aware. I'm checking my watch, and I didn't. That it was just almost like a nervous tick. But here's an interesting thought. Research shows that 55% of what gets communicated is nonverbal. 38% is tone. 7% of the words. So think about how much you're communicating, because a lot of times you can look really upset with somebody and say, oh, we're fine. And they're going to hear, or not so fine. Or you say, we're fine, in a tone. I mean, it changes. It completely changes how you're going to receive things. Now, another point I want to make is adaptability. And this will be the last point for today's talk. You have to adapt what you're saying to the people you're talking to, not talking down to them. But you have to realize, like, for instance, many therapists get accused of psychobabbling people. And saying these big words. We're not here to impress people. We want to be able to I think, distill and simplify concepts, not because the audience is simple. Many times they say, if you can't simplify a pretty complex concept, maybe you don't have a handle on it. But my test was when I came out of my doctoral program, one of my first jobs was working with adolescents who were in group homes and came out of detention and were being sent over from departments of social services. And I had what I believe information that they needed to hear. Sometimes it was very difficult for them because if they've been abandoned by parents or abused. But it did no good if I talked in long words. I had to find a way to simplify what I was saying so that it could be received by them. And that's important, to think about your audience, to think about how you're saying what you're saying. So you want people to understand you. You're not trying to impress them with your vocabulary. Now, one interesting thing, and I'll get into this more in a future episode, is perceptual styles. And you've heard me mention a couple of times Carl Jung's work on psychological types. By the way, he's the man who coined the term introversion and extroversion. He also talked about the way people perceive things. And I find this is very applicable in here because some people need the details. And other people, they're going to say, what's the big picture here? And we call them the perceivers and the intuitors. And and I always share this with teachers, I'd say you need to speak to both, because there's going to be people, even if you're making a point, who are going to really want to know the details about what you're saying. But if you never give them the big picture, the intuitor is going to have trouble getting some footing around what it is you're trying to convey. So it's learning to teach to people who need more broader understanding of where we're going here, what is this all about, what's the big picture, versus give me the details and specify. So these are all ways that you can learn how to communicate. And so for today, I'm going to bring an end to this discussion. And next time, I'll be talking about the unconscious, a little bit about how maybe it slips out when you're making a Freudian slip. But more extensively, I'll talk about how we as therapists address issues that clients bring in that we're not aware of and they're not aware of. But it very much affects how they are handling situations. So thanks for listening today. Oh, one last thing before I go. This is a community space, and I welcome any thoughts you might have, comments or suggestions about future episodes. You'll see my email posted at the end of the credits. And I'm hoping that some of the poems and the information may have struck a chord with you. And speaking of chords, and so for now, I'll say goodbye and hope you'll try to give some thought to what was taught and then abide in a place of peacefulness with lots of happiness inside.
Dr. Frank's Therapoems was produced by Le Splash Marketing. The poems and illustrations can be found in his book, Can I Be Frank? Poetic Insights that Empower and Inspire. Illustrations in the book are provided by Craig M. Lindemann. You're welcome to share these poems for non-profit purposes, but please remember to cite their source. Dr. Frank can be contacted at dr.frankstherapoems@gmail.com.